Oh, okay. Good morning, everyone. This is Alexis Fernandez with the Department of Social Services here in California. I just realized that our phone was on mute, so I'm sorry that we're getting started just a few minutes late, but I'm going to start over as if there were no technical challenges. So good morning and welcome to part 6 in our 7-part ABAWD webinar training series. Again, my name is Alexis Fernandez and I'm the Chief of the CalFresh Policy Bureau, stepping in for Amber Bonilla today, our ABAWD manager who had an unexpected conflict. But that's okay. I think you can all deal with having me for the next 45 minutes or so. I'm also joined this morning by Sydney Schellinger, our ABAWD analyst here at CDSS. Thanks for joining us. We're going to go ahead and get started. I'm going to go back a couple of slides. Okay, a couple of logistics before we jump into content. As always, the webinar will be hosted today in listen-only mode. There are 2 ways to listen in, via your computer or via phone. Information on how to connect is located on the right-hand side of your screen as part of the webinar panel tool. Okay, we have reserved time at the end of the presentation for participants to ask questions. If you would like to submit a question, you can do so at any time by entering your question into the question box, which is also on the right-hand side of your screen as part of the webinar panel. At the end of the presentation, we will address as many questions as time permits. We'll be keeping a record of all questions asked, and we'll do our best to answer questions offline as well. For those questions that we're unable to get to during the live webinar, we are keeping a running list, a Q&A document that will be released at the end of the series. It's pretty long already, so please do make sure that you get your questions in. And also note that the webinar will be recorded and made available after the presentation along with the PowerPoint slides. All right. CDSS launched the ABAWD webinar training series about 6 months ago, and we are quickly approaching the end of this series. After today's webinar on ABAWD 15% exemption policy, we will end our series with a presentation on the ABAWD clock, reporting, and meds. This final webinar, which will be held on January 9th from 10 to 11, will include a special presentation from our partners at the Department of Healthcare Services, who will be able to answer questions specific to meds and meds functionality. So just a special note for this upcoming webinar on January 9th, that DHCS has asked that we solicit questions in advance in order to help prepare webinar content that is responsive to your needs. So if you have questions specific to meds, please feel free to send those to any member of the ABAWD team here at CDSS, myself, Alexis, Amber, Danielle, or Sydney, and then we will prepare with our partners at DHCS to answer those questions regarding meds. Of course, we will take live questions during the webinar, but to the extent that you have the questions now, please do send them to us. As we have mentioned previously, each webinar in the series is meant to provide our partners with a starting point in developing their own understanding of the ABAWD time limit, as well as to aid in development of their own trainings. So let's go ahead and get started with today's topic, which will provide a high-level overview of the ABAWD 15% exemption policy. Taking a look at our agenda this morning, we will start with a very brief recap of our training series thus far, and a quick review of the ABAWD time limit rule for those who may be joining us for the first time. From there, we'll take a deep dive into 15% exemption policy, starting with some background information, a discussion of how the 15% exemption or how 15% exemptions are allocated at both the state and county levels. We will then discuss the current bank of 15% exemptions. We'll tell you more about that term coming up soon. And new statewide allocation criteria, which CDSS has developed with our stakeholders and partners. We will end our presentation this morning with some final thoughts and time for additional Q&A. All right. So for those of you who have just joined us today and maybe missed a couple of our past webinars, first, go back and take a look at those webinars. They're definitely worth listening in on. The recordings are posted to our website. But we'll also do a brief recap of the webinar series to help tie today's topic in with the broader discussions we've had thus far. We started our series with an ABAWD 101 presentation. We presented a high-level overview of ABAWD policy and time-limited participation. We then took a look in detail at ABAWD exemption criteria and how some individuals who may be considered ABAWDs are not subject to the time limit because they meet the criteria for one of the exemptions. As we discussed, this is one of the most crucial steps in implementing the ABAWD time limit. That is, making sure that you are applying exemption criteria effectively. We know from the experience in other states that roughly half to 2/3 of their ABAWD population are typically exempt from the ABAWD time limit. In September, we discussed how those individuals who do not meet the criteria for an exemption may satisfy the ABAWD work requirement through employment or other qualifying activities. The main focus of that webinar was to understand that an ABAWD who is subject to the ABAWD time limit must be involved in a qualifying work activity or employed for 20 hours per week or an average of 80 hours per month in order to meet the work requirement. We also talked about which activities can be combined to satisfy the ABAWD work requirement. In October, we discussed the process of counting months of ABAWD participation and touched on topics such as intercounty transfers, as well as how an individual ABAWD may lose eligibility for CalFresh. In that webinar, we discussed what a quote-unquote countable month of participation is and how we can determine whether a month would count toward the ABAWD time limit. On our last webinar, we focused on how an ABAWD who is subject to the time limit and has lost eligibility may regain eligibility for CalFresh through a few different ways, including satisfying the work requirement for 30 days, qualifying for an exemption, moving to a waived area, or reaching the end of the current 36-month period. We also discussed the unique provision called the 3 consecutive months of eligibility, which certain ABAWDs may be eligible for after they have regained eligibility. All of the presentations have been recorded and are posted to our CalFresh webpage. So if that was a lot to take in about a minute and a half, please do take a moment to go back to the CalFresh webpage where those recordings and presentation materials are available. Okay. As always, before we jump in to today's webinar content, we're going to start with a quick review of the ABAWD time limit rules. ABAWD eligibility is limited to 3 full countable months of CalFresh benefits within a 36-month period, while the ABAWD who is subject to the time limit does not satisfy the ABAWD work requirement or is not otherwise exempt. The ABAWD time limit applies to individuals that are between the ages of 18 and 49, have no dependents, and do not qualify for an exemption. For those ABAWDs subject to the time limit, they are required to meet the work requirement, either by participating in a qualifying work activity or participating in employment for 20 hours per week average monthly. 20 hours per week average monthly really means 80 hours per month. Okay, so with that high-level overview of our webinar series thus far and the ABAWD time limit rule, we are going to jump into our content for today, which is an overview of 15% exemption policy. The 15% exemptions were developed as a means of assisting ABAWDs who are unable to satisfy the work requirement for a variety of reasons that may be outside of their control. When the rule was originally implemented, there was some recognition that the ABAWD work requirement is relatively difficult and that our participants may run into life circumstances which, as we mentioned, are really outside of their control. And the flexibility to offer what we will call 15% exemptions helps states address the needs of those individual ABAWDs who may not necessarily need to be deemed ineligible for benefits. The 15% exemption allows selected ABAWDs to receive CalFresh beyond their initial 3-month period of eligibility. So we're going to jump into more detail about what exactly the 15% exemptions are. At the highest level, these are exemptions which provide states and counties maximum flexibility in addressing the needs of individual ABAWDs who may find it challenging to meet the ABAWD time limit. Okay, so let's get into the nitty-gritty of what the 15% exemption is and the background on how they are available to states. So federal law provides that each state agency be allotted a number of individual exemptions to the ABAWD time limit that are equal to 15% of the state's caseloads of ABAWDs that are subject to the time limit. These individual ABAWD time limit exemptions are known as 15% exemptions. 15% exemptions are allowable under the Food and Nutrition Act, if you're curious, Title VII of the Code of Federal Regulations at 273.24. But don't worry about trying to write all that down. We have resources listed at the end of the presentation for your reference. What these exemptions do is allow state agencies, or in California's case, individual counties, to extend eligibility to ABAWDs who would otherwise be ineligible due to the time limit. Each 15% exemption is equal to 1 month of CalFresh eligibility for one individual ABAWD. As I mentioned in the previous slide, states are allocated a certain number of these 15% exemptions. Again, each exemption is 1 month of eligibility, and we have a particular number of these exemptions that have been allocated to California. The allocation is based on 15% of the quote-unquote at-risk ABAWD caseload in the state. At-risk means those individuals who are subject to the time limit because they do not live in a waived area or they do not meet the criteria for an exemption. They are at risk of losing eligibility, which is why we use the term at-risk ABAWD. To determine the annual number of 15% exemptions that a state will accrue, FNS considers a state's ABAWD time limit waiver status at approximately July 1 of each year. FNS makes the determination based on data that we submit to them, where we provide a count of the ABAWDs in our state. And based on that count, they basically do some simple math and identify the number of 15% exemptions. So, for example, if we told FNS that we had 100 ABAWDs who potentially would be subject to the time limit, 15% of that 100, or 15, would be the number of 15% exemptions that we would be allocated. Keep in mind that that means that states do not earn 15% exemptions when they are covered by the waiver. So in other words, in California, 15% exemptions are only earned when the state has areas that are not under a waiver, and only for those subset areas. So if California loses their statewide waiver and 5 counties or 10 counties, however many, are subject to the time limit, we would tally the caseload in those counties, and the allocation would be based on 15% of that caseload. we haven't here in California earned 15% exemptions in the last few years since we've been under a statewide waiver. We will begin earning additional 15% exemptions when we lose our statewide waiver. We do have a substantial amount of 15% exemptions stored in what we call the bank, and we will talk about that in more detail on the next slide. Okay, so we've talked a little bit about how we accrue 15% exemptions in general. So moving forward, when California loses its statewide waiver, we will begin to accrue 15% exemptions. I also mentioned that we have what we call a bank of exemptions. So what does that mean? Well, first, it means that 15% exemptions are cumulative. In other words, any unused 15% exemptions from the past are carried forward to the following year. This applies in the future and in the past, as you could assume. So we have accrued a bank, quote unquote, of 15% exemptions from when we implemented the time limit years ago. Currently, California's bank of 15% exemptions contains over 800,000 individual exemptions accumulated from when we implemented the time limit in the past. Continuing with this analogy of a bank, if we, as a state, were to overutilize or quote-unquote overspend our allotment of 15% exemptions, we would also consider having to pay them off in the future years. So any overused amount would be deducted from the next year's allocation. This is why it's critical to use these exemptions strategically. You want to maximize utilization, so utilize all the 15% exemptions that you have been allocated, but you also want to reduce the risk that you overuse your allocation. So basically, imagine you have a savings account and you have an influx of cash into your savings account. Well, it's not a savings. We'll call it a checking because you want to spend it. You want to spend just enough that you're taking advantage of the money available to you, but you don't want to overspend because you will have an overdraft with your bank and you will have to pay that off eventually. So once California has received its annual allocation of 15% exemptions from FNS, CDSS then distributes these exemptions to individual counties. These exemptions are available to all counties who do not qualify for a waiver. So in other words, these are counties that are implementing the time limit. We will allocate the 15% exemptions to counties who are subject to the time limit based on the number of at-risk ABAWDs in that particular county. This allocation methodology mirrors the federal methodology and reflects the fact that some counties may have more at-risk ABAWDs than others. So similarly to FNS's methodology, where they are providing 15% exemptions to individual states based on the number of at-risk ABAWDs in that state, California will do the same for its individual counties. So each year, depending on the number of counties that are subject to the time limit, we will distribute the state's allocation to those counties. All right, so now we're getting to the point where the state has received the federal allocation of exemptions. We've allocated those exemptions out to counties that are subject to the time limit. And the next step is to determine how these exemptions will be allocated to individual ABAWDs that are subject to the time limit. The 15% exemption is the one place in the ABAWD kind of time limit provisions or rules where we have maximum flexibility as a state. There are no federal restrictions on how the 15% exemptions are allocated to individual ABAWDs. That said, what we know from past experience and from talking with other states that have already established, or rather have already implemented the time limit, is that establishing a statewide criteria or set of guidelines for the allocation to individuals is incredibly important in terms of both maximizing utilization, making sure that we're using that allocation of 15% exemptions as they're given to us, and not overutilizing. So finding that balance has been more successful in states where there's clear guidance around how the exemptions are allocated to individuals. We have worked diligently over the last few months with various ABAWD work groups and stakeholders to identify a set of statewide criteria which we think will guide the use of 15% exemptions at the local level. Before we dive into that criteria and the different categories that we have highlighted for application of the 15% exemption, I want to make an important note regarding individuals receiving benefits under the California Food Assistance Program, or CFAP. While CFAP individuals are subject to the ABAWD time limit rules, the 15% exemption is only available to federal SNAP or CalFresh recipients. CFAP individuals are not eligible to receive a 15% exemption because they are not receiving federal SNAP benefits. So an important note just from a technical standpoint, that when we talk about allocating 15% exemptions to individuals, we are talking about allocating those to recipients of federal SNAP benefits or CalFresh benefits. I'm going to hand it over to Sydney in just a minute here to walk us through the statewide criteria or guidance that we have developed with our partners and stakeholders. But before I do, I just want to make one additional note on the fact that these guidelines that we have developed with all our stakeholders, with our work groups, with our counties, are just that. They are guidelines for utilization. We realize that each county does have local factors that will impact which members of, how many members of their ABAWD population will meet certain criteria, which factors will be more present than others. So the expectation is that the guidance be used to produce local instruction, local policy, local training, that also takes into account the unique geography and unique population in each county. So we're going to walk through each of the criteria that we've established at the state level as a group, but I want to highlight that we recognize each county will have some unique characteristics that make some of these criteria more applicable than others. So again, we think this will help with utilization, but do recognize that locally some adjustments will need to be made depending on the geography and characteristics of the caseload. So with that, I'm going to hand it off to Sydney, and she's going to walk us through each of the criteria categories. Note that these criteria also appear in the ABAWD Handbook version 1.0, so additional details will be given for each of them when the handbook is released in early 2018. So Sydney, if you can take it away.
All right, good morning everyone. As we just discussed, to maximize utilization, CDSS has established recommended statewide criteria regarding the allocation of the 15% exemption to ABAWD individuals. These criteria are meant to guide the use of the 15% exemption policy at the local county level. This criteria includes, but is not limited to, overissuance and error protection, eligibility extension, and special circumstances. And I'll be discussing these further on the next few slides. The first way a 15% exemption may be utilized is for the overissuance or error protection. Individual 15% exemptions should be granted to individuals who were inadvertently issued CalFresh benefits after exhausting their 3 countable months and who did not satisfy the work requirement or qualify for an exemption in the month that CalFresh benefits were issued. For example, If an ABAWD subject to the time limit makes a required mid-period report of a drop in work hours within 10 days of the date the change became known to their household, but after their CalFresh benefits have already been issued for the month, the CWD may assign a 15% exemption rather than establishing an overissuance claim. Next, CalFresh eligibility may be extended to those ABAWDs subject to the time limit who make an effort to satisfy the work requirement but fall short on the number of required hours. For example, a 15% exemption may be provided to those ABAWDs who work 10 to 19 hours in a week but fall short of the 20-hour per week averaged for 80 hours per month requirement.
And I'll just jump in here and add that we think this will be a common experience, particularly for ABAWDs who are employed in fields or occupations that may not provide a consistent number of hours every month, or where there's an unexpected illness or other circumstance that has led them to not meet the exact hour requirement, but where the ABAWD definitely made an effort and would continue their employment into the following month.
Correct. And the final way the CWD may provide a 15% exemption to ABAWDs is in the following special circumstances, which are, of course, just a suggestion, but are for counties' reentry population or those on probation or with a criminal record, for those who are seasonably employed, for parents or households where a dependent child ages out, for former foster youth, and for families engaging in a family reunification program. We will now be providing more details on each of these special circumstances.
And before we jump in, I do want to highlight, kind of going back to the introduction on this, where an individual county's geography or caseload characteristics may come into play. These are good examples. Depending on the individual county's characteristics for their caseload, they may have more or less ABAWDs who are part of the reentry population. They may have more or less ABAWDs who are seasonally employed. And these are good examples of where we've highlighted as the state recommendations for implementing an allocation policy. But of course, depending on the county's geography and caseload characteristics, some of these categories may be more or less popular, if you will.
Right.
All right, so Sydney's going to jump into each of them now.
All right, so one of the first special circumstances is for reentry, probation, and criminal records. These individuals who are reentering the community from prison or jail, who are completing probation or have a criminal record, they may have challenges in securing and maintaining employment or satisfying the work requirement.
So the idea here is applying a 15% exemption may provide this client additional time to transition into employment if they're struggling to secure a job that would allow them to satisfy the work requirement. Or maybe they're in some sort of other kind of personal transition phase where an allocation of a 15% exemption might be just what they need to meet the work requirement the following month or shortly thereafter.
Correct. And another special circumstance where a 15% exemption may also be given out is to individuals who are seasonably employed. This includes individuals who are employed on a short-term basis. For example, retail workers who are hired for the holiday season, employees hired for tax season, or seasonal agricultural workers.
So again, these are individuals that are making the effort to work or participate in an activity that qualifies them to satisfy the work requirement, but because of the fluctuation in that employment, may need a 15% exemption to get them to the next work opportunity. So again, acknowledging folks who are making the effort to satisfy the work requirement and may find themselves in more fluctuating circumstances than normal.
Another special circumstance for 15% exemption is those individuals who were previously exempt from the ABAWD time limit due to living in a CalFresh household with a child under the age of 18, and that child turns 18 during the certification period. This can also apply to the child who turned 18 and may now be subject to the time limit if they do not meet the criteria for an exemption.
So this particular category recognizes the unique transition that some individuals will face mid-certification period. Applying the 15% exemption might allow that individual time to satisfy the work requirement, and may allow the county time to engage them in a qualifying work activity such as an ENT program or some other vocational training if they're not already satisfying the work requirement. So again, kind of just acknowledging that these special circumstances that individuals might find themselves in with a bit of transition time during the month when the 15% exemption is allotted to them may satisfy the work requirement thereafter, or participate in some sort of qualifying activity to satisfy the work requirement.
And like the previous example, these are for individuals who are former foster youth. And former foster youth include individuals who have turned 18 or up to 21 and have recently aged out of the foster care system. You can also apply a 15% exemption for these people to also engage them to make sure that we can have them satisfy the work requirement, or they might even be exempt. And another special circumstance is individuals participating in a family reunification program may also receive 15% exemptions. Family reunification includes those families who are engaging in a reunification program after having children temporarily removed from the house for more than 30 days. Had the children been in the home and included in the CalFresh case, these families would have been exempt from the ABAWD time limit. And the final special circumstance we have included is if those individuals are close to qualifying for an exemption or no longer be identified as an ABAWD. A 15% exemption may be applied to reduce administrative workload and prevent churn. For example, a 15% exemption may be given the month before an individual's 50th birthday or the month before a baby is born to an ABAWD father.
And in addition to reducing the administrative workload and preventing churn, there is the client benefit here that, unfortunately, with churn, as we all know, often when someone leaves the program, it is difficult to get them back. So if we know that this is a short transition period, possibly between being an ABAWD subject to the time limit and being exempt or not an ABAWD at all, applying that 15% exemption can not only be beneficial to the county, but to the client themselves, so that they're not coming on and off of our program and having to reapply. They may not come back to reapply once they've left. So just acknowledging, again, another transition period where we think we can keep people consistently on benefits.
All right, CWDs must track the usage of the 15% exemption. Failure to document and track appropriately runs the risk of QC errors and overuse. At a minimum, when a 15% exemption is given to a client, CWDs must document in the case file and add the appropriate code to the individual's 36-month record in med. 15% exemptions are also tracked quarterly via the Stat 47 report, and this is extremely important as the data from the Stat 47 is used to fill out the FNS 583, and as we discussed earlier, FNS uses this report to determine the number of 15% exemptions that will be allocated to California each year.
So we want to make sure that we are receiving the correct number of 15% allocation, 15% exemptions moving forward. We also want to make sure that we've accurately counted the number of allocations that we've already used. Okay, so now that we've talked a little bit about the categories that we are recommending for use of the 15% exemptions, we're going to dive into the topic of applying the 15% exemption for an individual ABAWD. Because the number of 15% exemptions are limited, there are certain questions a county should sort of ask themselves, or an eligibility worker should ask themselves before applying a 15% exemption. When an ABAWD has exhausted their 3 countable months of benefits within a 36-month period, and they have failed to satisfy the work requirement, the county should first assess if the ABAWD qualifies for an exemption or if good cause can be applied before assigning a 15% exemption. So there's sort of an order of operations, if you will, here, in that you want to determine a couple of things first before you apply a 15% exemption, so that you are sure to apply those 15% exemptions to individuals who truly need them. So first, you want to determine if the ABAWD individual qualifies for an exemption. As a quick recap, an ABAWD qualifies for an exemption if they are responsible for the care of an incapacitated person, reside in a CalFresh household with a member under age 18, are pregnant, are exempt from CalFresh work registration requirements, or are physically or mentally unfit to work. This can include a client who is receiving public or private disability benefits, who is obviously unfit to work, who maybe has medical certification that they are physically or mentally unfit or unable to work, or who are experiencing chronic homelessness, or struggling with alcohol or drug addiction, or escaping domestic violence. Those 3 circumstances in particular would allow a client to be determined unable to work and therefore exempt from the ABAWD time limit. If the individual meets the criteria for an exemption, they can continue receiving CalFresh benefits as long as they continue to meet the exemption criteria and other CalFresh eligibility rules. If the ABAWD is not exempt from the ABAWD time limit, the CWD should then assess for good cause for failure to satisfy the work requirement prior to assigning a 15% exemption. So if you remember from past webinars, good cause may be determined for households that fail to satisfy the work requirement for reasons outside of their control. This may include, but are not limited to, illness, household emergency, lack of transportation, and other reasons that qualify as a good cause. If the client had good cause for failure to satisfy the work requirement, there is no need to apply a 15% exemption. Months in which good cause can be established do not count toward the 3-month time limit. A rule of thumb to remember when assessing for good cause is to ask, would the ABAWD have satisfied the work requirement had this event not taken place? If the answer is yes, then good cause can be applied. If the ABAWD does not qualify for an exemption or good cause, then the CWD may consider applying a 15% exemption. And of course, we recommend that you reference the criteria we just walked through, as we think those are some of the particular situations in which a 15% exemption may be particularly helpful. So let's walk through a couple of examples before we get to the Q&A. And I do see that lots of questions have come in. Please do keep those coming. Before we get to the Q&A, let's walk through our first example. So this example involves an ABAWD who reports to the CWD that they will not satisfy the work requirement for the current month. They have already exhausted their 3 countable months, the CWD determines, and the CWD has reassessed for possible exemptions and has determined that the ABAWD does not qualify for an exemption. The ABAWD individual explains that how they would have satisfied the work requirement, but mentions that their car broke down halfway through the month and caused them to miss some of the scheduled work. Is the 15% exemption appropriate in this scenario? The answer is no. Oh, I'm sorry. Hold on one second. The answer is no, because if the individual's car had not broken down halfway through the month, they would have satisfied the work requirement. So in this particular example, the county may establish good cause. Oh, there it is. No, good cause may be established. That's what Sydney was signaling me to do. Okay, so example 2. In our second example, this involves another ABAWD individual who reports to the CWD that they did not satisfy the work requirement for the previous month because they were laid off from their job. Unfortunately, this ABAWD has already, or the CWD has determined that they will have exhausted their 3 countable months, and then the CWD reassesses for possible exemptions, but determines that the ABAWD does not qualify for an exemption. This individual explains that their employment was seasonal for the holidays and that they had reached the end of their employment period. That's how they were laid off midway through the month. So the question here is a 15% exemption appropriate in this scenario? And the answer is yes. This person had a special circumstance, as we had described earlier, where they were seasonally employed and did not satisfy the work requirement for that particular month, and a 15% exemption may be applied. Of course, I will add that the hope here is that by applying that 15% exemption and not causing a break in aid, the ABAWD, who is subject to the time limit, either can find new employment, perhaps other seasonal work, or the CWD could help them participate in some other qualifying activities that would allow them to satisfy the work requirement moving forward. A volunteer opportunity, community service, a vocational training, employment and training, CalFresh employment and training, any of the other options that we have for helping that ABAWD continue to receive CalFresh benefits. Okay, a couple of final thoughts before we get to Q&A. So just for clarity, there is no limit on the number of 15% exemptions that an individual client may receive, and each county has discretion when determining the number of months an individual will receive a 15% exemption. CVSS, however, does recommend that an individual receive no more than 3 15% exemptions within a 36-month period. And this recommendation is based on data kind of exploration that we did with some of our work group member counties. We looked at what we expected some of the allocations to look like in the first few years and the rate of utilization, and have determined that the recommendation is that an individual receive no more than 3 15% exemptions within a 36-month period at this time. Again, highlighting that CWDs are encouraged to develop local policy guidance and staff training that supports utilization of 15% exemptions based on the characteristics of their particular caseload and the community that they serve. The number of 15% exemptions allocated to the county and the unique characteristics of the geography and other factors. Next, it's also important that we distinguish, as part of our closing thoughts, the 15% exemption from the general ABAWD exemptions defined in federal law, the state regs, and the ABAWD handbook. These are uniquely different from the regular exemption criteria, which I think we all understand now at the end of the webinar presentation, that these are a whole other category of exemptions separate and apart from the exemption criteria which we've discussed on previous webinars. Another important note here is that those ABAWDs who are granted a 15% exemption are still subject to the time limit and must satisfy the work requirement moving forward. Receiving a 15% exemption only temporarily excuses the individual from satisfying the work requirement. After receiving a 15% exemption, the ABAWD individual must satisfy the work requirement or meet exemption criteria in order to continue receiving CalFresh benefits. So this brings us back to the beginning of our webinar, where we highlighted that each 15% exemption is singular and applies for a single month. So after a 15% exemption has been applied, the following month, that individual needs to satisfy the work requirement, meet exemption criteria, or receive another 15% exemption in order to continue receiving CalFresh benefits. We also want to acknowledge that there is still a strategy that is under development on how to spend down the current exemption bank. So the framework we've discussed today is really geared towards long-term strategies for utilizing new allocations. We're still working through allocations, or rather, still working through strategies on how to best utilize the bank of exemptions, knowing that implementation is coming up in 2018, so there will be more to come on that, but we are working with our county partners and other stakeholders to make sure that we also have a good strategy in place to use the bank of exemptions from the past. Okay, so that brings us to the end of our presentation. We are now going to open up the chat box for Q&A. So as a reminder, please submit your questions in the questions box. We're going to need a brief moment here to look over the questions we have received thus far. But again, if we don't get to all the questions, we are keeping a log and will be answering those in the Q&A document at the end of the series. And I'm also seeing, okay, that we're having one technical glitch here. Let me get my screen up for you again. Okay. All right, give us a second here and we'll get to our first set of questions. Okay, so this first question is about the term at risk. Will all ABAWDs who do not meet the work requirement or qualify for an exemption be considered at risk? So when we use the term at risk, we're actually referencing the number of ABAWDs who are subject to the time limit. So when we send data to FNS to allocate our exemptions, we break our ABAWD population into two categories, those that are subject to the time limit and those that are not. Individual ABAWDs who are subject to the time limit are considered at risk, regardless of whether they are meeting the time limit or not, because at that stage we're simply counting them as ABAWDs subject to the time limit. And then those who are exempt are in the category of ABAWDs who are not subject to the time limit. So at risk simply refers to those ABAWDs who are subject to the time limit and need to satisfy the work requirement in order to maintain CalFresh eligibility. Okay. The next question is about the accumulation of 15% exemptions. And the question is, did California accumulate 15% exemptions while we were under statewide waiver? And the answer is no. States only accumulate 15% exemptions when they're implementing the time limit. So for the last few years, since 2008, when we were under statewide waiver, we were not accumulating any new 15% exemptions. The quote-unquote banks that we've referenced were accumulated when we previously implemented the time limit, and then we will begin accumulating again when we implement the time limit in 2018. So there's a gap, if you will, when you're under waiver. Okay, so here's another good question, and this is really just high level and general. When will counties find out if they have, if they are eligible for an ABAWD waiver? So we anticipate that in the first few months, probably by March or April or so of 2018, we should receive notice from FNS regarding our waiver status. We are dependent on them somewhat to tell us what the status of our waiver is. And as soon as we find out, we will be working with those counties who are impacted. At this point, it's hard to tell. As you may be aware from previous webinars, It really is dependent on factors such as the unemployment rate, which change month to month, as you know, and data that is available to that. So we will be keeping folks in the loop as soon as we hear, and we're actively working with FNS to determine as early as possible which counties will be implementing the time limit here in California for 2018. Okay, here's another good clarifying question. Where can we find the ABAWD handbook? So the ABAWD handbook is actually in final stages of internal sign-off here at CDSS and is expected to be released in January. This will be handbook version 1.0, if you will. It reflects the work of several work groups and our partners and stakeholders over the last year, and then it will be revised with additional notices and resources over time. So 2.0 will be released later in the year, but do expect that in January of 2018. Okay, so this question has to do with tracking. We talked a little bit about tracking when a 15% exemption has been applied to an individual. And this question is about precautions in place to ensure that counties are not exceeding their share of 15% exemptions. I will also add to ensure that they're utilizing the 15% exemptions at a rate that is appropriate. And the way we will do that, so the plan right now is to look at the quarterly submission of the Stat 47 as a primary indicator, as well as potentially look at the MES data. So as the utilization is tracked at the county level, we will have some data points to look at utilization, either too high or too low, and then throughout the year, we'll be in contact with those counties about where they are in terms of needing to increase utilization or possibly, limit kind of individual application at the local level. So we will be setting some systems up to track that. Of course, it won't be real time. There'll be a little bit of delay there, but we'll be looking closely at utilization and working with counties who are implementing the time limit. The good news is, I will add, is as this rolls out, we expect it to be in a limited number of counties the first year. That will be a great way for us to determine which is the best system for utilization. And then the second year, I'm sure we will have some tweaks to make sure that the tracking is working as it should. Okay. So this next question is a clarification on our statement around CFAP eligibility. And to confirm, if a CFAP client who is subject to the time limit is not meeting any other exemption criteria and they have not satisfied the work requirement, does that mean that at that point, if they have used their 3 countable months, that they are ineligible for benefits? And unfortunately, that's likely the case. Because CFAP benefits are state funded, we cannot apply federal 15% exemptions to that case. So if the CFAP individual who is subject to the time limit has used their 3 countable months, is not satisfying the work requirement, does not have good cause, and does not meet another exemption criteria, then yes, it is possible that they will have to be discontinued. But I just want to emphasize the importance of first ensuring that they do not meet another exemption criteria and that they did not have good cause. Those policies do apply to CFAP individuals. And looking at the clock here, we have quite a few additional questions, but we will likely need to get to those in writing, follow up with folks via the Q&A document and offline. If you have any last-minute questions, try to get them in here as we wrap up. Want to highlight before we close for the day that our next webinar, the final webinar in the series, with our guests from the Department of Healthcare Services, will be on January 9th from 10 to 11, so please do make sure that you sign up for that webinar. As well, we've listed some additional resources here that are relevant to this particular presentation. The 5 previous webinar recordings and materials, information about the ABAWD time limit, and a link to the Code of Federal Regulations for those of us who are a little bit more wonky than others. So you can take a look at the 15% exemption policy. Again, I just want to thank you all for joining us today. Amber, Cindy, and Danielle's contact information is on this slide. Remember that special request to submit questions early for next month's webinar. So if you have questions about MEDS functionality and ABAWD tracking, submit those questions in advance and we'll try our best to answer them. Until then, thanks again for joining us today, and we will talk to you all in January. Happy holidays.